Hi, good day to everyone. Myself Haematology. I am representing from Advanced Haematology class to present about vitamin B12 deficiency to you guys. Let's get started. So for our presentation today, here are the topics we're going to discuss on vitamin B12 deficiency. So I'm going to discuss about what is vitamin B12 deficiency, the causes of vitamin B12 deficiency, pathogenesis, signs and symptoms, diagnosis, treatment, prevention, and one case study about vitamin B12 deficiency. So what is vitamin B12 deficiency? Vitamin B12 deficiency is a condition where someone or the patient is lack of vitamin B12. So here we go to know what is the function of vitamin in our body. So basically vitamin plays function in our body to make red blood cells. Why we need red blood cell? Red blood cells are the one carrying oxygen to all of our body part. Without sufficient of red blood cell, the body part can't function and can't produce oxygen for our body. So moving to the symptoms of vitamin B12 deficiency, symptoms might be vary from different patients. Not all the patients might have different symptoms because every body condition has different kind of symptoms. So among various of symptoms here I have listed few, which is irritability, nausea, smooth or tender tongue, numbness on our finger or legs, fatigue, loss of appetite, trouble in walking, diarrhea, and fast or rapid heartbeat, also lost weight. Followed by the pathogenesis, here I'm going to explain how and the pathway of someone is getting this condition. So basically it starts from lack of intrinsic factor or autoimmune destruction of gastric parietal cells and instinct factor. So basically, lack of intrinsic factor can cause inability to absorb vitamin B12 from small intestine, and that condition leads to insufficient creation of healthy red blood cells. When we have no healthy red blood cell, the body cannot function without carrying oxygen to all the parts. So these are the smallest and brief pathogenesis of vitamin B12 deficiency, followed by diagnosis of vitamin B12 deficiency. So basically, to detect vitamin B12 deficiency, we don't really go through any hard procedure. Just a simple full blood count and peripheral blood smear will do. So basically, PBF is done to observe any of abnormal blood cells in patient's blood to detect the vitamin B12 deficiency. So in this PBF, we might observe large red blood cell and hypersegmented neutrophils. So large red blood cells also called as macrocytic, which means macro means large, cytic means cell. Also hypersegmented neutrophils refers to basically normal neutrophil have 3 to 5 lobes, and these hypersegmented neutrophils means it has more than 5 lobes in the neutrophil, followed by blood sample, full blood count, NCV, which is mean corpuscular volume, is resulted in larger than 100 FL, suggested as macrocytosis. Also, a bone marrow study also can be done to detect vitamin B12 to look for the megaloblastic changes in RBC precursors at various stages of differentiation. As for the biochemical test that I have mentioned earlier, the homocysteine and methylmalonic acid level are also elevated if the patient is positive of vitamin B12 condition. Moving to the treatment of vitamin B12 deficiency. So basically, the treatment is very simple where only two conditions is suggested to treat vitamin B12 deficiency. Firstly, if someone is having this condition of vitamin B12 deficiency by dietary, it's treated with oral B12 supplement, which is given by or prescribed by doctors. Apart from that, when the problem is absorption related, as I mentioned earlier, if it's due to intrinsic factor that lack to absorb vitamin, then it could be treated with either really high oral B12 doses to allow for passive diffusion in the gut, or with intramuscular B12 injection for a couple of months, and which can be followed with oral supplements if it's needed. So either it's dietary supplement of oral B12, or it might be intramuscular injection. As for the prevention, monitor your B12 intake closely if you're pregnant or breastfeeding. Apart from pregnant or breastfeeding, everyone should also monitor your intake of vitamin B12, because vitamin is always should be in good level, not more or not less. Both will cause serious problem. Apart from that, monitoring your intake, whoever alcoholic also should avoid alcohol, because frequent alcohol consumption can damage the digestive system and make it difficult your body to absorb vitamin B12. Apart from that, eat recommended daily value of vitamin B12, because there are some foods that are rich of vitamin B12, like foods that crustacean food, vegetables, and dairy products that rich of vitamin B12, followed by fortified foods, which is include certain breakfast, cereals, nutritional yeast, and plant milk, and certain bread even also can prevent vitamin B12 deficiency. So here is one case study that I found, where it's about a 10 months old boy having vitamin B12 from the mother who is already having vitamin B12 deficiency. So this case study have mentioned about the symptoms that the baby, where the which is the 10 months old baby have gone through, and I've highlighted to the black and bolded to be more specific. And there are also some laboratory investigation and findings that refers to that refers to the vitamin B12 deficiency. So basically, the mother was vegetarian diet, and the baby was stopped gaining weight after 6 months, and it became less active. The baby also falling to follow object visually. He was unable to sit and was making no attempt to crawl or vocalize. As for the laboratory findings, it is demonstrated with microcytic anemia, as I mentioned earlier in diagnosis part. Vitamin B12 deficiency is associated with large red blood cell, which is also called as macrocytic cells. As for the MCV, the normal value for baby from 0 months to 4 years is 88 FL, where the finding in case study shows as the baby's MCV is 112 FL, which is the MCV value is increased. So let's go to the case study explanation. Based on the symptoms and laboratory findings below, as I mentioned, vegetarian diet, less active, pale, lethargic, stopped gaining weight. So basically, the reason the baby got vitamin B12 deficiency is through the mother who is already having this condition, where she was vegetarian diet. For a mother who is breastfeeding a baby, she really need all kind of vitamin from all the sources, include meats and vegetables. As this mother was already vegetarian diet, so she was breastfeeding the baby for 6 months. Basically, before a baby started to consuming a solid food, the baby's nutrition and vitamin was fully depend on the mother's breastfeed milk. So when the mother is vegetarian diet, so she's already lack of vitamin, which has no sufficient amount to pass to the baby. So this caused the symptoms for the baby of vitamin B12 deficiency, such as less active, pale, lethargic, stop gaining weight. So those 4 symptoms, as I mentioned earlier in my presentation symptom, is already tally. Apart from the symptoms, the laboratory findings such as microcytic anemia and the MCV, which is increased to 112 FL, is also associated with vitamin B12 deficiency. So basically, vitamin B12 deficiency was diagnosed through a combination of clinical and laboratory findings, including clinical presentation, increased mean corpuscular volume microcytosis, and low vitamin B12 level, while the brain computer tomography CT revealed the cerebral atrophy with delayed myelination. With this, I'm ending my presentation. Hope you guys like my presentation. Thank you so much.